These are called turbohalers, and they're used for asthma treatment. This is a reliever, and this one is a preventer. And this is how to use them. First of all, take off the top and check that there's something left in there. There'll be a red ribbon if it's empty. Some of these will have counters on. Then you need to activate it, and you must do it with it upright, not like that or like that. Upright, and you twist the bottom forward and back. And that means the next dose is ready. In order to take that dose, the thing to do is to empty your chest, tip your head right up so you've got a straight column going down to your lungs, and then pull this in as hard as you can, hold it in, and then exhale down your nose. So it goes like this. I'll turn sideways so you can see better. Breathing out, head up, same with the other one if you need it. The more you can pull this into your chest, the better. Use your inhaler regularly as directed. That'll give you better asthma control. Good luck. Thanks for listening.